Go ahead, Deb.
Okay, thank you, Mr. Chairman. So our data for today, our numbers for today, we have 10 positive cases, so no new cases identified today. We did have one new case earlier this week. 9 of our positive cases have recovered. We have 19 in isolation or quarantine, and we've had 718 negative tests. And I have seen over the course of the last couple of days, we seem to be having more people tested in our community. I believe that it's a result of the asymptomatic folks being tested, essential workers, staff at our hospital system, staff in the nursing homes, et cetera. So there remains a lot of concern across the counties regarding the mandated nursing home testing of employees. I think that in Schuyler County, I think the hospital and Seneca View and the Falls Home do have their plan in place. And I've not heard any concern from them specifically. I'm just hearing concerns from the other counties and the other nursing homes that I work with on Ontario side. But I think that in Schuyler County, they have their plan in place. The hospital is going to be assisting the Falls Home in training staff so that they will be able to collect their own samples. They will be assisting in the fit testing of the nurses there so that they can wear the proper PPE when they are collecting the samples, and then they'll be working with the hospital for having those specimens submitted. But the requirement is that all nursing home and assisted living facility staff must be tested twice a week. That's quite a heavy lift at a lot of different respects. It's a heavy lift for the nursing homes, for their staff who are affected by being tested twice a week, having the lab capacity to actually process and run those tests is quite a bit. And then the other thing that I wanted to report to you, so in preparing for some, I guess, normalcy in our operations at the Public Health Department, and knowing that, you know, we are now at the time when people are out with their pets and the rabies vector species is more prevalent. You know, the raccoons are up and about. As soon as the weather is warmer, we'll have bats flying around. I felt that it was important for us to at least start the discussion of how might we operate a rabies clinic to help our community keep their pets up to date with their rabies vaccine. So our next scheduled clinic was to occur on June 6th at the Hector Fire Department. With some assistance, my staff met with the folks at the Hector Fire Department, but then we've also met with the Burdett Fire Department, and we've worked with the Sheriff's Office, and we think that we have a pretty good plan in place now so that we can conduct a drive-through clinic at the Burdett Fire Department. We will be requesting and actually requiring that people register to attend, because we've got to be able to control the flow. We're not going to, we don't want to turn people away, but we do need people to register so that we can control the flow, and people will be given a time slot and when they should arrive so that not everybody is arriving at the same time. The clinic is scheduled for a Saturday, which is you know, the day that it originally was scheduled to occur. And rather than being an hour long, we will be conducting the clinic over 2 hours, again, so we can stretch out who comes and when they come. The people who come will be asked to stay in their vehicle. They will not be getting out. And the vet, I believe it's Dr. Gray, who will be the veterinarian. She has been part of the planning process for this. And she was very interested in helping to conduct a drive-through clinic. And actually, I believe what's occurring at some of the veterinarians' offices is that they aren't even having everybody come into the office. If it's just for a rabies vaccine, they're actually going out to the car. So we're hopeful that this will help our community to keep their pets current, and we'll assess how well it goes and make changes for future clinics. Are there any questions or concerns that people have?
Deb, this is Michael. So you mean the June 6th clinic will be at Burdett? It'll be switched over to there.
Yes, they have bays that we can use, so the people will actually be in queue and they will drive into the bay. They will remain in their car, and the veterinarian has a plan on how she will handle the cats. The cats have to be in a carrier, and there's a room there that the cat in the carrier, the vet will take it into the room, will vaccinate the cat, and bring the carrier back out to the individual's car.
And that's June 6th, Deb?
It is. It's June 6th. It's a Saturday.
Okay, thank you. Anything else for Deb? Deb, do you have anything else?
I do not.
Deb,
Okay.
I have one quick question. Given that this is a point-in-time test, the wineries are scheduled as a phase 3 opening. Is it suggested that some of us should start going now, or wait till closer to phase 3 opening so we get a better picture at that point in time when we actually will be meeting the public?
Yeah, it really is just a point in time. So I guess if you want to make sure that your employees are as best you can assure that they are not infected, I guess I'd wait until closer to when the winery might be opening.
I would agree.
Because,
Okay.
you know, if they're tested now, but the winery's open in phase 3, and that's, you know, sometime later in June or early July or whenever that ends up happening, they might be positive then. So
Right. Yeah, that's my concern. The reason I was actually asking whether to do now is just so that we would get our numbers for the phases to continue the testing.
I think we're probably going to be able to meet that metric with.
Okay.
Actually, we're exceeding it as a region pretty significantly. And with the nursing home requirement, it will easily be,
Okay, so the nursing home requirements will count toward that testing then?
to my knowledge, yes. Yeah.
Okay, good. That
Okay,
better.
other questions for Deb? All right, thank you very much. We appreciate the time. Bill Kennedy?
Yeah, Bill's not on, but if he were, I'm sure he would be saying that not a lot has changed beyond the last report. However, he has been the intermediary as the state has pushed out vaccines or testing, I'm sorry. He's been running to Geneva to pick them up and then distribute it to the hospital and other testing points. We've also been receiving masks with some regularity from the stockpile, and we've pushed out to all of the human service agencies, but we're stockpiling the remainder, and actually we'll be distributing those through the chamber and through probably our human services complex as well to businesses, with the thought that as we reopen and face masks should be required, that businesses will be able to, rather than get into a confrontation with customers, if somebody doesn't have a mask, that they will be able to provide one for them. And the analogy, the simple analogy is customers are already used to no shirt, no shoes, no service. This is really just one more add-on to that. No shirt, no shoes, no mask, no service. But we will provide masks. We right now have about 12,000. We are distributing 5,000 to the chamber and they're putting a media release out tomorrow. We'll do it for as long as we can. on that front. But so I believe that's the emergency management update. If anything is different, I'm sure we'll get back to you on that. But that's from my last conversations with Bill. That's where we're at.
Good.
Deb, I have a question about the Humane Society. Do you know where they fit on the reopening?
I don't.
Is it,
I don't either.
I mean, it would be for adoptions, so, but I don't see, unless, in the list of businesses that can do the curbside.
Yeah, I don't know where they would fall.
Okay.
That's it. I'll ask that on my call tomorrow.
Oh, great. Okay, thanks.
I hesitate to make any assumptions if it's not written that in the phases of who can open at the governor's level, then I'm hesitant to offer any suggestions.
Mhm, yep,
Absolutely.
that's good.
Okay, Kim, you want to go to the reopening then?
Sure. Can start with a few updates. We've following up from last week's discussion, the using June 1st as a target for county reopening. Continue to meet with the administrative team, and we're looking at how and when to reopen offices. The DMV, we would like to get reopened, and actually we're thinking that June 1st was an easy one, but that is subject to the executive order closing them. So that does not fall into any phase. The executive order needs to be rescinded or amended to allow DMVs to open back up for in-person transactions. That is being addressed. So right now, they wouldn't be eligible to open until June 7th. But is on this afternoon's call, the governor's office is aware of that, and they are working on that, and we expect more direction on that hopefully in the coming days. Also, to kind of go off on tangents a little bit, but on the subject of executive orders, there are probably the number one question, or one of the top questions that we're hearing is, when can I get my hair cut? Or when can I get my nails done? Or when can I get a tattoo? Any one of those things. And actually the answer is, we don't know. Those businesses were also closed by executive order. So that's why you'll see they're conspicuous from the list of phases. So those also are subject to the governor's okay to move forward. There's certainly the recognition of that being a burning question, and we again await direction from the state on that. With respect to the business community reopening, I'm sure you're aware that as a region, we are one of 4 now that meet all the criteria to reopen starting tomorrow. I shared with you several drafts actually of Kristen's work with the business community and our efforts to meet with the business community and develop a uniform, easy to follow plan. And we thought we had a great solution until yesterday. And actually that's when the state came out with their own protocols. And actually I'll share those with you. I'll share my screen to bring that up. So, oops, wrong screen. Let's see. It's the this one. And at about 7:30 last night, I got an email with a link that to direct to businesses for reopening. I'll kind of run through this for you, just as if you were a business. In fact, I'm developing a video, so this is practice for that even. But businesses will be directed to go to the Forward New York website. There is a phased reopening link, and once you click on that, you'll come into a breakdown of what's eligible to reopen on the 15th, and as well as what the other 2 or 3 phases are. And as you can see, they're not open, and you can't do anything with respect to those at this point. But for example, for the purpose of example, I'll use the retail, which is curbside retail that becomes operational tomorrow. So you would pick your category from whatever business you're on. From there, it will take you to a more definitive list of businesses that are eligible to reopen. And again, only for delivery, curbside or in-store pickup, similar to takeout food service right now. From there, this will give you the guidelines that you will be expected to comply with. And there are two categories, mandatory and recommended. The mandatory, are, as the name implies, mandatory. So each business would have to agree to comply with all of the regulations for their respective industry. From there, actually, I'll go back to the guidelines are spelled out. Then the actual registration part is the attestation form. As you can see at the top, when you've read this document, you can affirm at the bottom. When you go to the bottom, after reading it word for word and understanding every bit of it, of course, there's a link to take you to an attestation form. You'll click the appropriate boxes, you'll fill in the names and all the contact information. And basically, I am the owner of the agent of the business listed. I have reviewed the guidance for the business reopening and operations, and I affirm that I have read and understand my obligation to operate in accordance with such guidance. When you submit, a certificate will be generated that you have submitted your plan and you agree to comply with all of the requirements. And then beyond that, you will be required to have on site a COVID-19 reopening safety plan. And this is a template the state's devised. You can use the template or you can develop your own, but it must contain all of the elements in the guidance documents that were provided before that. So it certainly would be more simple to just use the template and fill it out for your specific business. And then that is to be kept on site. And should there be an inspection or response to a complaint, the business owner is expected to have the reopening plan available for inspection. That's the process. It also applies to every business that it has their doors open in whatever fashion. So if you were an essential business and have been in operation or never stopped operation, you still will need to complete this process and do an attestation that you agree to comply with all of the requirements. For the businesses that are open, in theory, they've been doing this, but they will need to go through all of that as well. There will be a link for that purpose, supposedly by this evening, for businesses that are already open, and they will submit as well. The state is not reviewing plans, nor is the county, for that matter. But it is a self-reporting, and it's expected that every business that enters the phased reopening will comply with these steps. So that all came about well, like I said, at 7:30 last night, we got all of this. And we are rolling it out to the business community. The chamber has already put something out. Like I said, I'm putting together kind of a video that emulates what I just did. And we'll post that as well as COVID-19 updates. And so that's where we're at. I'm sure there are going to be a lot of questions coming forward from this. There's already been some confusion in some restaurants thinking that they could open for outside dining, which they can't. And that's kept the public health department hopping and putting out those fires. But at this point, we reopen tomorrow. We monitor daily our statistics, and we hope that our numbers don't regress, and, both as a county and certainly more importantly as a region. And with any luck, in 14 days or sooner, we move to phase 2 and repeat the process. So I given you a lot to digest. I'll stop there. If there are any questions, we'll try and answer them.
Tim, who's supposed to inspect these?
Well, there's not a there's no intent on our part to conduct inspections to make sure of compliance. However, practically speaking, if there's a complaint on the establishment, part of the response to that complaint would be to ask to see the plan. And if the business, say,
So who gets the complaint?
well, the complaints are coming either directly to us through emergency management, or we're getting them through the hotline through the state. And in that case, myself, the mayor of Watkins Glen, the sheriff, Bill Kennedy, and the town of Dick supervisor receive the complaint. Our process is they all go to Bill Kennedy to be dispatched for investigation as appropriate. Typically, it's a law enforcement response, and then public health if necessary. I will say that in all of the complaints that we've received, the response from the establishments has been that of compliance. Recent liquor license revocations notwithstanding, but businesses that have been shut down by the state weren't even on our radar. But should a business decide that they're going to open their doors on their own and not follow the regulations, the state was shown today with the establishment in Monterey will take steps to pull licenses and shut down businesses. That is not going to be our approach. We're not going to take a heavy-handed approach. We're hoping for voluntary compliance, both from the businesses as well as the visitors and customers. But we're not going to be policing this. That's not something we have the resources to do, nor quite frankly the desire to do. But we will be responding to complaints because we have to.
We can go to those online on the New York website.
Yep. It's forward.ny.gov, and
Yep.
all the information, actually the dashboard with the metrics, the information the regional control board reviews every day will be posted online within that day as well. So this is as transparent as you can be. So, and you
Gotcha.
can drill down not only from the region, but into individual counties to get statistics that will typically be probably about 24 hours behind, but they will be, you'll be able to take a look at any county in the state, any region in the state, all through this website.
Thanks.
Mm-hmm.
Other questions? That was good, Tim. That went smoothly. Stacy, you have two discussion items. Can you get into those, please?
Sure can. Just wanted to review with everybody that we'll be doing things as we have been the last 2 months. May committee meetings have been moved to June 3rd, 9 o'clock in the morning. We'll go through all the committees and then review resolutions with any questions like we have the last 2 meetings. That's it on that. And the chairman and Tim and I have been discussing, hopefully, in June, maybe coming back into the legislative chambers and live streaming meetings, but that'll be a day-by-day discussion. Item 4, look to Legislator Harp, Chairman of Public Safety, relative to your impact statement resolution. It has been on numerous agendas and tabled numerous times. I can certainly put that on the agenda again for June 3rd. I didn't know if you wanted to pull it off the table, have meetings with the appropriate departments, and possibly bring it back when we're all able to meet in person.
That's what I prefer to do, Stacy. Okay.
Okay. That's all I needed, direction on that.
Anything else, Stacy?
No, sir.
Any other questions? Anything for the good of the order?
Yeah, I'd like to bring something up. Wondering if anybody here has any additional information other than the announcement that was made a couple days back of State Senator Helming and Assemblyman DiPietro's intent to submit a bill to rescind the governor's executive orders. And just because it's my intent, I would like to develop a resolution supporting that, but it seems like it'd be getting ahead of the curve. I can't find that they have submitted or any bill number yet, and so just was wondering if anybody has any better information than I have seen on this.
I haven't seen anything other than the press release, but I haven't seen any legislation.
Right, that's the extent of what I had seen, and just wondered if anybody else out there was better informed. So I guess I'm going to hold on.
See anything in the USAC notes or anything either.
Right, and I didn't see it. I did a search for legislation in committees, and nothing showed up there yet either. But just was wondering if anybody had heard. But that is my. And the other question is it's an economic development issue. So I can see that coming from CDNR, but is there anybody else who believes that it's more appropriate for a different committee?
You're talking about the resolution you just spoke about?
Right, the resolution to support the Helming DiPietro bill when it actually comes out.
But I would say it's CDNR, but if anybody wants to discuss that, that's fine. Everybody comfortable with that?
I would say, Mark, just keep me informed. If you receive something, we can work on putting something on in our agenda.
Okay.
Just to clarify, what is the subject matter? Are we talking about the reopening or like the suspension of the open meetings law, or what?
No, this is basically the generic authority that the governor was given in light of COVID-19 to issue executive orders, bypassing normal legislative prerogative. And this is to rescind that power.
Okay.
Interestingly, the legislature gave him that power. They didn't know they were doing it, but they did it. So,
right. Well, and that's the intent here, is to say that they're giving a rethink to that action.
mm-hmm.
Okay, any other questions? Anything? We can call the meeting closed then. Thank you very much. Appreciate your time.
Carl, before we do,
Yes.
Carl, before we end the meeting, I think everyone by now got a copy of a draft resolution. Did everyone receive it on crimes? It's on the concerning the coronavirus.
I've got it.
Yes.
Okay. Okay. Would you review that and give that some thought, and basically looking to at some point raise the issue all the way through the Secretary of State for the United States, Mike Pompeo, and then on down the ladder through Albany and our local congressional representatives. And it is to pursue through both the International Court of Justice and the International Criminal Court, which basically is the world court, if you will, pursuing the culprits responsible for this, whether it's accidental or intentional. And basically that is yet to be determined. But whether it is proven to be accidental, still sue some type of indemnification by the Chinese government to this country, in the business interruption and the effect nationally on the individual deaths of 8,000 people. So take a look at it, and if you have questions about it or want to discuss it, I will be happy to discuss it, or when we come on what the date was on June 3rd at the committee meetings, okay?
I would ask one question. Does this meeting still have value for you? Do we want to continue? I certainly think it does have value, and especially as we go into 4-phase startup, there's going to be a lot of questions from, our constituents. Why did we do this? Which way do we go? Where do I get information? That sort of thing. And I think, half an hour, we did a half an hour tonight. Half an hour will cover a lot of territory for us, but that's up to the legislature. What's your thought? Anybody want to terminate this?
I think
No,
it's worthwhile to continue to meet. I would support continuing to meet.
I think
would-
it's okay, continue, Van. Sorry.
So, oh, no, excuse me. Okay, Mark, sorry.
Okay,
continue.
okay.
I think it's essential that we continue because you may see actually spikes in cases as this reopening goes on too, and we really need to keep informed.
All right, well, depending on Deb's schedule and Tim's and Ken and Bill Kennedy, we'll keep it at the same time. Just keep an eye on your email in case it has to be changed. Because
Tim
Tim's
is-
called off on a lot of these meetings.
Well, Tim's frozen. Are you still on,
No,
Tim?
no, I'm on. I just switched to a different, see, I wanted to see if that worked, so.
That's what happened Monday night, so I thought you got kicked off.
Yeah.
Yeah.
You want
Uh,
to borrow Suzanne's iPhone again, Tim?
I don't know. I found out why that happened too, so
That's good.
it's all
You have-
correct.
You have a telephone booth, Andy?
Change into Superman.
I think we
Gotta-
currently have these meetings scheduled right up through June 9th.
Well, then we can